Good morning on a cold start to your day, and welcome to Local 3+U, the same local focus on our show, just with a little bit of an added name this morning. Going to keep it very local for you on this wintry day, because for anyone watching out there suffering from neuropathy, so many people in the Tennessee Valley do struggle with that. We have got some help for you this morning. Dr. Sean Jones kicking the show off with us today. He is with Chattanooga Wellness, 2 locations in Chattanooga, also in Cleveland, and his patients are finding great success with his neuropathy plan. Good to see you this morning, Sean.
Hey, Happy New Year. It's great to see you in 2022.
Absolutely. You always have kind of that optimist approach, ways to look ahead to something you can do for your patient. So this neuropathy that you'll be talking about today, this focus you have on it, really is something you've been doing for a while, but patients are kind of hearing about the word and the success rate you've had with it, and they're coming to you in droves.
Yeah, they are. And what we do is, we've been doing this for 4 years now, and we keep improving our program. Every time we find something new, which I'll talk about in a minute, we add that to our program. And I keep seeing on my own Facebook feed lots of other doctors and chiropractors out there that are using what we use for home treatment as their treatment in the office. And our feeling is we should do in the office what you cannot do at home, and spend your money where it's best spent. And that's with Chattanooga Wellness Centers, because they have a 98% success rate. Now, part of the stuff that we do is, of course, we do the chiropractic care on the feet, the low back, or the hands, wrists, and the neck, as long as there's not a surgical reason not to work on the spine. Otherwise, we just work on the extremities, and then we use a thing called K-laser. Now, K-laser we talked about many times in your program. It's a fantastic, powerful 20-watt laser that super heals. Now, all laser does 4 things, remember. Decreases pain, decreases swelling, increases blood flow, and it super heals tissue. It makes your mitochondria of your cells, your powerhouses, supercharged and heal things up very, very fast. So that's a wonderful tool that we've used for years.
Can I ask you something before you move ahead?
Yes,
when you're talking about patients with neuropathy, many people watching today know that they have neuropathy. They struggled with it for a long time. Do you ever have people come in, though, and they don't even realize that's what they have? They just think they've had some tingling or something in their leg?
Exactly, we do. In fact, sometimes they come in thinking they have neuropathy and they actually have plantar fasciitis or some blood disorder or something else. That's why we do a full consultation and history and evaluate you to make sure that you do have neuropathy. And then in our examination, we determine exactly how bad is this sensory loss. And are you losing balance and falling and hurting yourself in other ways? Because if you don't do something about neuropathy, it's going to tend to progress. That's a great question. And of course, for those of you that don't know if you have neuropathy or not, you have burning, numbness, tingling, pain, paresthesia, like pins and needles feeling, balance issues. There's all kinds of symptoms you have, and you get it both in the hands and the feet. And diabetes is the number 3 cause. Like we talked about before, the number 1 cause now is chemotherapy. You beat cancer, now you got to deal with neuropathy. Number 2 is surgery. Having surgery on a knee or low back or an ankle can also cause neuropathy to develop as well. And the 3rd most common cause is diabetes, sugar issues.
Okay, I know that you just had a technical malfunction there, but it's the power of live TV, so to speak, because what just knocked off of your shelf is part of the second item you wanted to discuss, because you have
it was just a supplement. We use supplements with the program too. We try to take a full faceted approach. So what we do is we have a nutritional component to your healing. We have the in-office care. So what I'm showing today more is the in-office care. And if your degeneration is bad enough, we send equipment home with you to treat yourself twice a day at home, while you're also coming in twice a week to our offices.
So on the nutrition supplement type of side of things, Sean, is everyone going to get the same thing, and what's in it?
Well, it depends. If somebody's diabetic, we also add in some wheat germ oil to stabilize the blood sugar, and another supplement that helps the pancreas to heal. But we have other supplements we take also that increases vasodilation and increases nitrous oxide, because that's the real cause of neuropathy, is the loss of nitrous oxide. Now, the coolest thing is we have this brand new piece of equipment called sound wave therapy. And with sound wave therapy, what we do is we send powerful sound waves to actually tear down the tissue. This is the opposite of what a laser does. The sound wave therapy here, we go in and we dig in And these powerful sound waves will break up adhesions, like I've been treating my thumb from being a chiropractor, and it feels fantastic now. And so what we can do is tear down the tissue and then rebuild it. And this works really good after surgery too. When somebody's had surgery, they have old adhesions, and sometimes surgery works and sometimes it does not work. What do? We can go in with this machine and break up those adhesions in the back and in the feet and get that neuropathy and leg pain feeling much, much better. Usually in the first visit, you see a big change.
When you say you go in and you break up the adhesions, what exactly are you talking about? What is an adhesion?
Yeah, adhesions form anytime you have a surgery, anytime you have an injury, you're going to have adhesions. We take care of a lot of people after car accidents. We want to make sure we stop adhesions from forming that restrict your motion, they get rid of your flexibility. So what we want to do is go in here and we can break up where you have adhesions from old chronic problems and bust up those adhesions so the tissues can rebuild. And what happens is it brings your body's own natural stem cells and other healing factors to the area that we treat. And that's why you feel better. And we even have those kind of patients, you know, we have such a high 98% success rate with neuropathy. There's no reason to suffer. But there are those patients that will not do what a doctor asks them to do at home, no matter what we do. For those patients, we can skip everything and just go right to the shockwave therapy and come in and you can buy a package of shockwave therapy and we can go in and break up those adhesions. You just come in and get treated, go home and do nothing. And guess what? You still get results.
Okay,
so we evaluate to see what's best for you when you come in.
We've got less than 2 minutes. I'm sorry to be thick-headed, but you said some patients don't always want to do what you're asking them to do. What's the at-home protocol?
At-home protocol, we have a red light therapy that we use that we send home with people. I've got it right here. And it's a wonderful instrument. You can wrap around your back, around your ankles, your feet, your hands, your shoulder. Your wife or husband can treat themselves as well because you own the equipment. And then we also use a rebuilder. It's an electric stim that's set up special to train the nerves to function again. Now that's only if you have more than 50% sensory loss. If you don't have more than 50% sensory loss, there's no need to spend expense on home equipment. We can get you well just in the office. We've treated you several times in the office over the course of 2 to 3 months, and the problems are resolved. And we have a 98% success rate. There's no need to suffer. If you're suffering and staying up at night and you're not feeling well, and you can't travel, you can't walk around and go shopping and do things anymore with your family, call Chattanooga Wellness Centers. We're the place for neuropathy in the greater Chattanooga and Cleveland areas.
All right, here's how you can get in touch with Sean and his team. It is Chattanooga Wellness. You heard him say the 2 locations, Cleveland and Chattanooga. Phone number here in Chattanooga, 643-2277. Up in Cleveland, you're going to call 790-5000. And you can go online to laserawaypain.com, also ChattanoogaChiropractic.com. We're back after this.